Lights out.
Welcome, everyone, once again to another episode of SleepTech Talk, the sleep podcast for all you sleep professionals out there. And hey, we just want to say thank you all for all the support you've given us all these past several episodes. Continue to give us the thumbs up, the likes, the what have you, wherever you can. Make sure you enter the comments. We really sincerely appreciate that. And just want to remember you to do it once again for this episode. With that, let me toss it over to Emerson.
Hey, thanks so much, Jerry. We are so fortunate today to have with us a good friend, Sree Roy. Sree comes to us from Sleep Review magazine, where she is the editor-in-chief of the magazine Glossy. And we would describe this as a glossy trade magazine. I love that statement for sleep medicine subspecialty and sleepreviewmagazine.com. Sree has been at the helm of Sleep Review for more than 8 years. She's also the host of the MEDQOR podcast network, where she also covers sleep medicine topics. So you can reach her at editor@sleepreviewmag.com. So Sree, we're absolutely thrilled to have you with us today. There's so much that you get to be a part of and at the forefront of. But one of the things I'd love to ask you really quick before we really dig into this is, how did you get involved in sleep? Is this something that you sought out? Did you sort of fall backwards into it like the three of us did? Or how did you get here?
Well, thanks for having me. And I definitely fell backwards into it too. I am trained as a journalist. I am not a sleep medicine professional. I went to the University of Georgia's Grady College of Journalism. And from there, I had a variety of journalism jobs, writing about a variety of industries. But now at over 8 years, sleep is a beat that I have covered for the longest. And I really kind of wish I'd found it earlier. Like now I describe myself as a healthcare journalist. I've gone all in. I'm in like healthcare journalism associations. I go to conferences for it. I just find it so fascinating and so much more interesting to me than previous topics that I've covered, which were more, I don't just like less serious and less impactful. I really like writing about sleep medicine because I feel like it impacts everyone's lives. It's definitely impacted my life. I've improved my own sleep, helped, other people in my family just with sleep hygiene and other tips like that. But yeah, I did not seek it out. But since I found it about 8 years ago, I really, I would love it if I could spend the rest of my career covering sleep medicine, to be honest. We'll see how that goes.
That's neat. I'm glad we're not the only ones that didn't start out this way. And it's fun to hear that. One of the things that you and I have talked about in the past is sort of the great trends that we all get to look forward to, and you get to be on the forefront of all of that. One of them is diagnostic technology. If you could give us some sort of spotlight into what you're seeing, because right now it seems like, especially among sleep diagnostics, there's a lot happening. I mean, every time I turn around, there's some new gadget, some new solution. I mean, I'm even sporting an Oura ring because I'm a total nerd about this stuff, but not that that's a commercial, but there's a lot happening in this space right now. So if you could give us some sort of insight into what you're seeing in these diagnostic trends, that would be fantastic.
Yeah, happy to. It's funny because in 2020, I wrote an editor's memo. I think it was called like clinically validated sleep wearables are coming. And I was just thinking about like consumer tracking devices at that point and how they would become more accurate, but it's so much bigger than that now. Now there's FDA cleared devices that are wearable, that are wireless, and that are really comparable in a lot of ways to in-lab PSG, which is just, it blows my mind that I feel like it happened kind of quickly. So we wrote an article about, it was called The Future of Wireless Home Sleep Testing is Here. And in there, we cover like quite a few of these FDA approvals that have come across my desk recently. So just a lot of wireless things, like Onera has like a patch-based device that got FDA clearance in April of this year. So just recently, Wesper has a 2-patch system that also is cleared for sleep diagnostics as of January of this year. Accurable, a company, I think they're based in the UK. They have a device called AccuPubble that actually goes kind of on that neck. And that was cleared in November of last year. And then there's a ring, kind of like you're probably just as easy actually as your Aura ring to wear by Sleep Image, that is also cleared for I think that one is clear for limiting sleep apnea diagnosis and management, I believe. But I was just kind of surprised, honestly, kind of how quickly, I mean, I'm sure they've been in the works for a long time, but just how quickly, like in, 6 months time, there's like 4 different FDA clearances for these wireless wearable home sleep tests. And then beyond that, there's quite a few that are pending that we talk about in that article, some that are approved in the UK and not here yet. But are working on kind of that clearance. And so I think it's just making things like a lot easier for the patients. And it's just really kind of a neat time in sleep medicine to see all these kind of wearable diagnostics.
Sree, how about the therapy space? I love the world of technology and certainly all of the technology related to sleep diagnostics, but you also report on therapy, new therapy solutions as well. Can you tell us a little bit about some of those and what you're seeing?
We do. Neurostimulators are definitely like a growing category that I'm finding. So that would be like, Inspire for obstructive sleep apnea or Remedy for central sleep apnea. They're seeing like a lot of momentum. And then like it's kind of its own category in a way, but it is a neurostimulator. The Excite OSA device, which is a daytime neurostimulator. It's like the first of its kind obstructive sleep apnea therapy device. I believe it's only for mild sleep apnea, but it's like a tongue kind of stimulator device. And that article definitely got a lot of views on our website the day that was cleared and even ongoing. I just think that's kind of fascinating. And then another thing that I was just recently writing about, which I think we'll see in the next, I would say 2 to 6 years, if I had to give my best guess, is sleep apnea drugs, like oral pharmacotherapy. There's a good like 6 companies right now that are working on sleep apnea pills, and several of them are in like phase 2 clinical trials, and they're looking to phase 3. So that's another thing that whenever I get any kind of press release about, a status update from any of those companies, that definitely gets a lot of interest on our website.
Yeah, that's very fascinating to hear, Sree. I mean, you're exposed to all these things that are cutting edge, and you just spoke about 5 to 6 years from now. Anything else do you see in the horizon in sleep health you think are going to be dramatically different than what we're seeing today?
I mean, I definitely should, mention the gold standard therapy of CPAP. So that I just think their devices are going to get smaller, masks are going to get better with fewer leaks. There is also, let me think what other things have come across my desk recently. Oh, for oral appliances, actually, we just published a really neat article about some technology for oral appliances on the horizon, which is the micro sensors embedded in them. So we've written about those for years. I mean, I remember writing an article about micro sensors and oil appliances just after I came on, like 7, 8 years ago. And those were just wearing adherence, like was the patient actually wearing the device or not? So it really had kind of limited use. But the newer ones, which none of these are FDA cleared yet, but they're working on it, they will actually measure efficacy. So like AHI, oxygen desaturations, one of them in development actually says it can measure EEG from its location in the mouth, which was crazy to me. And so I think that could really be a game changer. Like if and when any of those get the FDA nod, I think that would really kind of maybe put oral appliances more on par with CPAP as far as, physicians willing to prescribe them, because now, at best, it's like you can just tell if somebody's wearing it, and adherence with oral appliances is not so much the issue like it can be with CPAP, but there are other issues about, is it working? So that's another really cool thing. And also if it's in the person's mouth and it is measuring, AHI every night, I mean, that also allows, for the sleep physician to kind of track the progression of the disease.
Another thing that comes to mind when we talk about this some amongst the three of us is artificial intelligence and the impact it's having on healthcare as a whole. When you look at sleep and some of the new companies that have really entered this space, I mean, what's really standing out to you? And then what is the implication? Because I know that's something you think about as well, as with these new technologies, whether it's the new home sleep apnea technology or AI or even the therapy we were just talking about with oral appliances. What does that really mean? And what does it mean for the future of sleep medicine?
I think the cool thing about artificial intelligence is that it can go kind of beyond what a sleep tech can do. I mean, sleep techs have to score, in these increments of time, and you have to skip a lot of the data. Like maybe you're just counting like the apneas and hypopneas, and that's all, you have time to do, and, some sleep staging. But with artificial intelligence, like there's so much more in that data that we don't even necessarily know to look for, like patterns and things that it can tell us. And when you don't have to manually score it, when it can score so quickly, and I just feel like there's like a lot of mysteries in sleep that will be uncovering because of artificial intelligence. And then that, is on top of kind of the practical use of, just any kind of automated sleep scoring can just be a lot faster, and then maybe be confirmed by, a sleep tech and a sleep physician afterward. I mean, it's not perfect, and I don't think it will eliminate sleep tech roles, and I hope it doesn't. I think it'll just be like another tool. But I do think like there's a possibility that it will uncover things about sleep, especially like in the EEG, like, what K complexes mean and stuff like that we don't even know like to look for, but that a computer can find patterns in.
Sree, so this is really interesting, talking about artificial intelligence in the future. Any thoughts of predictive analytics when it comes to being able to combine all this data that we're getting from all these various devices and the artificial intelligence? Any thoughts on that, or anything you've seen come across your desk?
There's definitely companies that are kind of have their own algorithms to try to predict adherence. And so they will like segment out, the patients using whatever factors that they have identified, whether it's like demographic factors or psychographic factors, and try to make it easier, I think, for the patients to be managed, because obviously it's time consuming. Like you can't really like call every patient like 3 days after they get their CPAP and see if they're using it, or at least you probably don't have time to do that. But with some of these algorithms, like if it can tell you like, these patients the computer has identified are probably going to be adherent, like based on whatever characteristics it's figured out. But then these like 15 patients, we think they're going to have trouble. So maybe you can actually just focus on calling those patients and helping them become adherent. So I do think that is something, as these algorithms kind of get refined, that companies can start, or that sleep labs and sleep techs and sleep practices can maybe start kind of managing by exception, if they can get good like machine learning algorithms that will tell them like who to focus on.
Sree, I have to tell you, I'm pretty impressed with your ability. You sound like a sleep tech. I know you've been doing this for a long time, but how have you? I think it would be easy to sort of report on some of this stuff, but you really have a comprehensive knowledge of the patient care aspect of the sleep medicine field, and how all of these different technologies and new therapies are going to impact patient care. Has that just sort of organically, you developed that organically over time, or have you really done a lot of research in addition to, the reporting that you do?
Well, I'm really flattered that you would say that. For me, like my motivation when I'm coming up with story ideas or editing something for sleep review is just how can I make sleep professionals' lives easier? And so that really is my motivation, like beyond anything else. And so in that way, like with that kind of behind everything I do, I kind of put myself in other people's shoes, I guess. And I talk to a lot of sleep techs. I've got a great editorial advisory board who I, meet with, and, email chat with and, find out what they're up to. And then I just know what it's like to be really busy and like really want to do a good job. And then sometimes feel like you don't have time to do the great job that you want to be able to do. So any time that I can like find something that makes it easier or see like what obstacles a sleep tech is facing, and maybe I can write an article about how to overcome some of that, like that's just something that really motivates me. So I think it's just talking to people. I go to conferences, typically, when there's not a pandemic, I'll go in person. I attend, webinars, not only the ones that Sleep Review hosts, but if I get an email, about some webinar that a company is doing, and I think it sounds interesting, I'll attend that. And I also like to read, the comments on Sleep Review's website, or sometimes people will send me emails about issues that they're having. So I guess I just feel like I kind of just gather the knowledge from everywhere. And I just really try to put myself in that position of working overnight in the sleep lab or working day to day in a sleep practice. And what am I trying to accomplish and what are my obstacles to accomplishing that?
One of the things that I love about our field and the colleagues that we have is their passion. There are so many passionate techs, and their knowledge of sleep technology is just immense. A lot based on experience, but also based on their learning and everything like that. How often do you really rely on that group in particular to submit articles, to submit work to you? And if somebody ever wanted to write with Sleep Review and submit something, what does that process look like? What do they need to think about? And I know you have guidelines that you and I've talked about before, but what does that process look like for that person out there that's a good wordsmith and is passionate and would love to be a contributor to the public dialogue?
We do accept articles from sleep technologists and from all sleep professionals. And you're right about the guidelines. If you go to sleepreviewmag.com, it's relatively new actually that I put them on the website. It's on the if you scroll to the bottom, it says submit an article. So look for that, submit an article on the bottom of our website, and that'll give you details. And it has some links to some of my favorite articles that have been submitted by sleep professionals. So there's some examples. In short, our word count is usually between, 800 and 1,500 words is kind of a typical word count for us. I like articles where it's like first person, like something where that individual is really sharing something that they have learned on the job. I don't really prefer the ones that are more, research overviews. If it's your own research and there's something, especially if it's clinically applicable, then that is something we might be interested in. But otherwise, like stuff in the day-to-day job is kind of what I'm looking for, whether that's like a case report, whether it's a trend that you've seen in your own sleep lab, whether you came up with maybe a protocol for dealing with certain types of patients that, whether it's bariatric patients or pediatric patients or something unique like that, that you think will help other sleep professionals. Like that's the type of thing that I'm interested in. It can be totally first person essay written just based on your experience. It could be your experience and maybe interviewing other sleep professionals and quoting them. One of our board members, a sleep tech, Robert Lindsay, probably 6 or so months ago, he wrote an article for us about the evolution of the PSG tech role. And it was a lot of his perspective, but he did interview other folks in the industry and he had quotes from them as well. We've had a lot of the dentists on our board. Ken Mogel, Tony Diagardi have written for us, and even taken photos of Tony did an article about intraoral scanning for oral appliances, and he took some step-by-step photos for us. So that was really neat. But those kind of things, like something that other sleep professionals can learn from, and something that's really based on your day-to-day life is kind of what I'm looking for. And then in that kind of 800 to 1,400 word range. And those, and I prefer if they're fully written before they're submitted to me, but if not, you could send in, a paragraph kind of pitch of what you want to do, and then I can get back to you on that. And either way, whether it's fully written or whether it's a pitch, it could be sent to editor@sleepreviewmag.com.
I can think of one great story. It's about 3 guys who started a podcast for SleepTech.
Well, if you want to write it up and submit it.
Well, Sree, thank you so much, but we're out of time right now, and we sincerely appreciate you bringing this insight to us. And I would agree with what Robert said. The way you're speaking sounds like you're a sleep tech. It would have fooled me. So, but it shows us all how deeply ingrained you are in the industry, and we thank you so much. In my career as a sleep technologist, and even until today, I still read Sleep Review magazine. So I'll tell you that that's how much of it is part for all of us in the industry, that it's an important part for us. So we thank you so much for that as well. But with that, we want to say thank you to all our listeners and viewers out there. We sincerely appreciate all the support you've given us. And we thank you so much for the continued support. Keep it up. Keep giving us the likes, the comments, and the shares. With that, we say cheers. And until next time, lights on.